Happy to have everybody here today virtually. Some of you today who are here know who our speaker is, and so he wouldn't need any introduction at all, Dr. Glockenflocken. However, for those of you who did not know who Dr. Glockenflocken is, and I don't even know if I'm saying it right. I don't even know.
Pretty good. That's pretty good.
That's pretty good. Okay, good. And for those of you who are trying to figure out why we would ever have an ophthalmologist give to a talk about internists about humor, Will Flanary, Dr. Flanary, who's also known by his moniker Dr. Glockenflecken, is more than just an ophthalmologist. He's a writer, he's a comedian, and he moonlights in his free time on Twitter and TikTok as Dr. Glockenflecken. Dr. Flanary effortlessly blends humor with education, and he spent the last 5 years informing audiences on a wide range of topics, navigating the confusing world of over-the-counter eye drops, not sleeping with your contacts in your eyes, the horrible and their horrible consequences, and his most recent experiences as a patient in the medical system. He also has two beautiful daughters, Charlotte and Claire, who co-star in many of his TikTok videos. Dr. Flannery's work has been featured in The Opthamologist and on kevinmd.com, a site many of you know, as well as on the popular medical satire website, gomerblog.com. And he also got his second dose of his vaccine a couple days ago, so if he vomits on the screen today, then you'll understand why. So, Dr. Flannery, thank you so much for being with us today.
Thank you. All right. Are you doing some slides first, or am I?
You're good to go.
I'm good? Okay, awesome. All right. Let me just share my screen real quick here. All right, so, hey, thank you so much. What a great turnout. This is amazing. Thank you so much for having me. It is 5 a.m. out here on the West Coast. I still kind of have my morning face on. So, but I have, since it's 5 a.m., I have officially set the world record for the earliest an ophthalmologist has ever voluntarily gotten out of bed. So I'm very excited about that. But it's honestly, it's okay. It's going to turn out great because I'm at my funniest between 5 and 6 a.m. So this is going to be perfect. I really am though excited about giving a talk like this to the Department of Medicine, but I'm a little nervous. I'm going to be honest with you, because everyone knows all you guys in internal medicine, you're the smartest people in the hospital. Smart by like not even close. Smartest people in the hospital. And I remember as a med student sitting in on internal medicine grand rounds and just sitting there in awe, listening to the rheumatologists and the nephrologists arguing with each other about things I didn't understand. And I guess what I'm saying is that if there are any rheumatologists and nephrologists on this call, if you guys want to start arguing with each other, I'd be fine with it. It's totally fine. About who's funnier, I don't know, whatever you want. It'd be kind of a sense of nostalgia for me. That would be okay. The last time actually that I thought about internal medicine was during my intern year. I did my intern year in IM, and that was 7 years ago. So it's been 7 years since I've thought about hyponatremia. Can you imagine? Can you guys imagine 7 years without even thinking about electrolytes? But that's kind of what ophthalmology is, you know? And despite the fact that I haven't really thought or done any body medicine for that long, I took a lot away from my intern year. I learned a lot. And those of you who follow me on Twitter and TikTok know that a lot of my humor, a lot of my content, I draw from my experiences as an intern.
Good morning, Mr. Johnson. How are you doing? Mother of God. Sir.
Yes, what is it?
It's the jugular vein, sir. It's distended. What do we do? Who should we call? Everyone. Hey guys, what do we have? Oh. Mm-hmm. Look, there's an A wave. Yeah, it's a little elevated. There's a V wave, too. Did you see that? No, what? A Y descent. And is that a C wave? C wave? You can't see a C wave.
I'll be when I recorded that. Honestly, I have no idea what any of that means. But that's what I found on Wikipedia, so I just went with it. Okay, so fortunately though, I don't have to talk about internal medicine because that would be embarrassing for me. No, I'm gonna talk about something that's a little bit more in my wheelhouse. We're gonna talk about humor in medicine. So in particular, I want to talk about. I'm gonna start by discussing a little bit about the history of humor in medicine, and then we're going to talk about why we use humor as medical professionals, why it's so important, and then also how we use it. What are the motivations behind the way we use humor in medicine? And then toward the end, we're going to get into specifically social media and how that's changed the way we use humor, because it has changed. It's changed the way that we really need to approach how we tell jokes to each other online. And so I'm going to start at the very beginning, though, very beginning. So the first time a joke was ever told in medicine, this is Sushruta. He was an Indian physician surgeon in the 6th century BC. And he was actually the first person to ever blame anesthesia for a surgical complication that was entirely his fault. It's really interesting. Okay, that's totally made up, but I am going to start with the phrase laughter is the best medicine, because we've all heard this 1,000 times throughout our lives. So what's the origin of this statement? Laughter is the best medicine. How did that get started? So if we go back to like 12th century, 1200s, 1300s, you have people like Henri de Mondeville here, who propagated the use of humor as post-operative therapy. And him and other people like him would do their grisly Middle Ages procedures of amputations without any anesthesia, and basically just have patients laugh it off. And it sounds crazy to us now. Obviously, that's all they had back then. And it's despite that, it actually caught on. A lot of people were doing this type of thing and using all kinds of other medical interventions that didn't really work. And so it, it it did start to catch on, and then centuries later, now we're getting into more modern times. In the past 150, 200 years, there's actually been a lot of research attempts to look at humor, to look at laughter as a treatment for disease. And when you go through some of these studies, and I've done it for you, so you don't have to, you find that researching humor is hard. It's really a difficult thing to do. If we're assuming that the randomized controlled trial, right, is the highest form of evidence, then the notion of controlled tests of humor and laughter, it's extremely problematic. When doing a medication trial, you can hide the ingredients of the medication that each group is taking. So the group's taking placebo, doesn't know it's a placebo. Well, laughter, it's not delivered in a container that you can hide a non-laughter equivalent. How do you do it? How do you mask a study about humor, about laughter? It's hard. Not only that, but is it even a good idea? It actually reminds me of this quote by E.B. White: analyzing humor is like dissecting a frog. Few people are interested, and the frog dies of it. I can't think of something that would kill humor faster than trying to study it. It sounds awful. But despite that, people have done it. There have been all kinds of these laughter experiments of people trying to determine a link between laughter and humor and improving health. And some of the conclusions from these studies are you just get a sense that this is just so difficult, and people are very frustrated by trying to do this. You have people like Cousins in 1979, laughter, who tried to claim that laughter is a good form of aerobic exercise. Probably does burn calories, but not to the aerobic exercise type of level. Mahoney in 2001 actually found that forcing laughter increased pain. So it actually made things worse. And then you realize that with these two studies down there at the bottom, that you're trying to fit something that's entirely subjective, humor, and what makes people laugh. You're trying to fit that into this qualitative, this research box, and it's just hard to do. How do you count laughs? How do you turn this into data? It's really hard, and so obviously none of these things really panned out to there's no real link between using humor and improving health. But through all these experiments, these dozens of experiments, we do have good data showing the physiologic effects of laughter. And there's a lot of good evidence behind these things. So decreasing heart rate, blood pressure, stress hormones, making you feel good, increasing your serotonin levels, and increasing your pain threshold. So I think all those guys in the Middle Ages were onto something. By trying to just make their post-op patients laugh, hey, that's all they had. Maybe it was worth a shot. Their patients all probably ended up dying laughing, but that's at least they tried something. And so I think we can all come to the conclusion: laughter, clearly, it's not the best medicine. It's not even medicine at all, but it is good for you. It is good for you. And so why do we joke? Why? I want to switch the focus to us as medical professionals. Why do we joke? Why do we use humor? What are the motivations behind it? And so to do this, to talk about this, I want to frame this in the context of my experience in comedy. There's not a whole lot of like comedian ophthalmologists out there, and so so I'm going to talk a little bit about my experience and kind of where my motivations come from. So I started doing stand-up comedy as a high schooler, and I continued that into college and into med school. But I always viewed it as a hobby. So I knew I wanted to go to med school since I was in junior high, and so comedy was always kind of a side thing. It was just something I like to do, and I like to make my friends laugh. It was a lot of fun for me. But I never really seriously considered it a career because it's too hard. Being a successful comedian is incredibly difficult. So I went the much easier route of becoming a doctor. And so I ended up going to the Dartmouth Medical School, which is now called the Geisel School of Medicine at Dartmouth. Do you guys know who Theodore Geisel was? Dr. Seuss. Dr. Seuss. So Dr. Seuss, their estate, gave $200 million to Dartmouth and got their name. So I was actually the first graduate of the Dr. Seuss School of Medicine, which is exciting for me. I was really happy about that. No cat in the hat on my diploma, though. Missed opportunity there. But I want to show you two things about this photo. This is at my white coat ceremony. Number one, and I want all the attendings to pay attention here, okay? I want you to realize how humiliating it is to make a tall med student wear a short white coat. Okay, look at these sleeves. 4 years I walked around like this. This is so. Please have mercy on your med students over 6'3" because it's awful. It's really. And the other thing I want to point out is obviously the most beautiful part of this photo, and that's my hair. Look at those. Look at those locks. I was for several years, my hair doesn't grow like that anymore, but for several years I was the envy of every elderly female patient over the age of 70. They loved my hair. They were incredibly jealous. So like I said, I continued doing stand-up into med school for the first couple of years. And I did a lot of open mics. I did comedy competitions like this one here. Which they unfortunately misspelled my name on the bill. I was very unhappy about that. It was actually a recurring theme in my comedy career. It would misspell my last name. You'd think I would learn from that. And when I later chose a pseudonym for comedy, I would go with an easier name, but no, I went with Dr. Glockenflecken. I never said I was smart, okay? And so, but the type of comedy, the type of humor I was using around this time was geared around my experience in medicine as a brand new person in medicine, as a med student. And so it was trying to grasp all the things that I just didn't understand, and all the things you're trying to learn so quickly in medicine. And I would say that that's what a lot of med students now, that's how they approach comedy. It's trying to overcome this huge influx of info that it feels overwhelming and it feels impossible to deal with. And it's actually perfectly summed up by this philosopher who I think he died about 10 years ago, but Ted Cohen. But he wrote a lot about humor, and he said that joking helps us acknowledge and integrate painful absurdities, which is a perfect way to put it, because it's painful as a new med student, as a new person in a field, regardless of what it is. It's painful because there's so much you have to know, so much you don't understand. And so what you try to do is you use humor to rise above, to try to gain some semblance of power over this powerless situation you find yourself. And that's a huge reason for how we a huge way that we use humor is in those types of situations. And so, and even today, I use a lot of my material that I make videos of comes from that feeling, because I'm close enough to med school that I remember what it's like. I remember that feeling of being overwhelmed and not knowing uh, uh, how to do or how to accomplish a lot of the things that we have to accomplish in med school. And so things like cardiovascular. I remember thinking, okay, how will I ever learn to hear an S5? How can I ever do that? Because I'm an ophthalmologist, I feel obligated to tell you guys, okay, I know that that's not a real sound. All right, that's part of the joke. I feel like I tell you, or just having to read an EKG. These painful absurdities, these things that you feel like you're never going to get, and so it makes you feel better to joke about it.
There's something happening here, but what it is ain't exactly clear.
Can you guys tell that that cardiology really did a number on me psychologically in med school? So I think I ended up in the right field. All right, so I kind of stopped. I got out of stand up for a while. Toward the end of my second year, things were getting busy. I was studying for boards, starting rotations in the hospital. My wife and I had a baby in third year, and so I got away from stand up, and about the end of my third year, beginning of my fourth year, I woke up one morning and I felt a lump in my testicle. And I was a med student at that time, but I knew, I still knew that my testicle wasn't supposed to try to grow another testicle. And so I went in, got checked out, diagnosed with cancer. I had surgery, I had treatment, and everything went okay. I didn't have to have any chemo or radiation or anything. But it really took a number on me because when you're in your early 20s, mid 20s, you have this sense of invincibility, like nothing is going to hurt you, like nothing can get you, and so when you have something like this, it just strips that away, just like that. And so I had a lot of emotions, a lot of feelings. I had to work there. I had to try to get through that. A lot of fear, a lot of anxiety, and I. It reminds me of this quote by Sigmund Freud. For all his faults, he actually had some interesting things to say about humor. He said that joking serves the psychological function of avoiding internal and external obstacles. And I had a lot of internal obstacles at this time. I had a lot of these types of deep-seated issues that I had to try to work through, and I'd been out of comedy for about a year at that point, and I just felt this sudden urge, like I got to get back into, I got to get back on stage. I got to tell jokes again. I got to work through this the only way I knew how, which was by using humor. It's clearly my defense mechanism. And so these were all these internal obstacles, and I didn't know how to overcome them. And so I was using humor to again try to gain control over this situation. I don't quite agree with it's avoiding obstacles. I think that might be the wrong word. I think it's kind of attacking them head on and trying to find some leverage over all these things you're feeling when you have an event in your life like this. And it's something we all do. We all do this. And then so I recovered okay. I got back into stand-up for a while, and I went on to residency at the University of Iowa. And about 4 years after my initial diagnosis of cancer, I was in my final year of residency, I woke up one morning and I felt a lump in my other testicle. So I was part of the lucky 1 to 2% of people who have testicular cancer who get it in the other testicle. I won the lottery twice. It was, but the second time was much more devastating, because I had a lot of questions I had to answer. I had a lot of things to figure out. Do I bank sperm? Are we done having kids? We had 2 kids at that time. What's hormone replacement therapy for the rest of my life going to be like? How much is all this going to cost? Am I going to postpone residence? All these questions that were in my head that I had to figure out. More internal obstacles that I had to take on, and so. But this time I still didn't have time to do comedy. We had 2 kids at that point. I was in Iowa City, not exactly a comedy hotbed, and so I had to find a way to tell jokes, to get my comedy out there, to use that skill I had that I enjoyed so much. And so that's when I started writing for the satire website Gomer Blog. It's how I joined Twitter. And basically, Twitter is just perfectly made for comedians because it's easy, it's digestible. You can easily, put your jokes out there, and so it worked for me. It allowed me to attack my internal obstacles that I was having. And I went by the name Dr. Glockenflecken. Now, a lot of people actually think my last name is Glockenflecken, which is just delights me to know it. I love that people actually think, how fortuitous would it be for an ophthalmologist to have the name Glockenflecken? Because Glockenflecken, it's not my name, it's actually a thing in ophthalmology. And I'm gonna teach it to you right now. So there's how could I ever, you guys love teaching in internal medicine, so how could I have this opportunity and not teach you anything about ophthalmology? All right, I just couldn't live with myself. And so I'm gonna teach you what Glockenflecken are. And I just want to preface this by saying, in no way, shape, or form is this information going to be helpful to you in your life, in your career. You'll never think about this again. It's not going to stop me, though. So Glockenflecken occur in the setting of angle closure glaucoma. So angle closure glaucoma occurs, basically your eye is like a bathtub. Think about it that way. So your eye is constantly making fluid through a faucet and draining fluid through a drain. Well, you have the steady state pressure in the eye. Well, if you clog the drain for any variety of different reasons, this can happen. The pressure starts to build up in the eye. And if it builds up high enough, then you start losing flow of oxygen in the eye. You start losing the flow of nutrients, and certain structures inside the eye start to die off. That's why high pressure in the eye is so bad. Things like the iris, you can start getting holes in the iris. One of the things that starts dying off are cells in your lens. This big giant thing here is your lens. When you're looking through someone's pupil, you're looking right through their lens. Well, you have little cells that start to die off when the pressure gets high, and they form these grayish white clumps called Glockenflecken. Hilarious, right? So of course, and the reason I chose that name is just because it's the funniest word in ophthalmology, in a field full of funny words. And so I went with it. Dr. Glockenflecken. And then And so I did that for, and I'm still doing it. And so that, I started telling jokes on Twitter, getting into social media, growing my audience. And then 4 years after my second diagnosis of cancer, I had a cardiac arrest in my sleep. This was now in May of 2020. You guys, I try to die like every 4 years. I'll tell you what, my wife is sick of it. She has had enough. All right. I cannot do this again to her. And I'm really going to try hard not to. I really am. But sometimes it's hard. Sometimes it's hard to stay alive. So at about 4 o'clock in the morning, I had a cardiac arrest. My wife woke up she heard me, I was having agonal breaths, and she called 911. Didn't know what they were at the time. She's not in medicine. She's never done any chest compression, nothing. She's in education. And so they instructed her to start doing chest compressions. And she proceeded to do 10 consecutive minutes of chest compressions, 10 minutes. Now, I'm an ophthalmologist, all right, so I don't get the opportunity to do chest compressions very often. If I do, something has gone horribly wrong in the clinic. But I do remember what 2 minutes of chest compressions feels like that I did as a med student intern. And it's exhausting. So I can't even imagine how she felt doing 10 minutes of chest compressions. The only explanation I can come up with was as to how she was able to do this effectively is that she's some kind of an Avenger. Did I know that I married a superhero? No, I did not know. She kept this skill away from me, and maybe she has other superpowers. I don't know. But she did the compressions for 10 minutes. EMS finally arrived. They took me downstairs in our house, put an IV in, intubated me, shocked me 6 times, eventually obtaining sinus rhythm, and brought me to the hospital. And I woke up in the ICU about 3 days later, and I was okay. It was amazing. I was able to talk and hold a conversation and answer questions appropriately. And so I recovered pretty quickly and was given a portable defibrillator to go home with. You guys seen these life vests? So you probably have seen patients that have these. They're basically, it's for all intents and purposes, it's an electric bra is what this thing is. When you open the box, the first thing, I wish I had a picture of this. You open the box, the first thing you see is this elderly gentleman without a shirt wearing this thing. And as a 35-year-old seeing this, it's just like, it hits you in the face. Like, what is my life? Like, what is happening? How could this possibly be what's going on right now? And this, I would say, was one of my external obstacles, because the only way I could think I could overcome this was by making jokes about it. And so that's exactly what I did.
As I walk through the valley of the shadow of death, I take a look at my life and realize there's nothing left. Cause I've been blasting and laughing so long that even my mama thinks that my mind is gone. But I ain't never crossed a man that didn't deserve it. Be treated like a punk, you know that's unheard of. You better watch how you're talking and where you're walking, or you and your homies might be lying and chalk. I really hate the trip, but I gotta low. As they croak, I see my...
So I wore that thing for about 3 weeks until I was finally able to get an implantable defibrillator in my armpit, which I have today. And we still don't know the cause of the cardiac arrest. It's the strangest thing. All of my work of everything has been normal. And so the little did I know that having the cardiac arrest and recovering from it was the easy part. That was the easy part. So within a few weeks, I started to get medical bills. And again, I had a 3-day hospitalization. I had a lot of testing done. I had, lots of stuff happened to me during those 3 days, but I ended up getting bills of over $200,000 total for that hospitalization, which we're all in U.S. healthcare. None of us are surprised by this, right? When I give similar talks about this I've done it for our Canadian friends, I get gasps, and they're from that total. And then and the thing is, it doesn't all come at once, right? It comes like every few days. You get a bill. You get a bill. And so and then I was looking at these bills, and I found that I was getting some where the insurance is billed like several $1,000s, and you can see here their insurance isn't covering it. I was like, what's going on here? This is an emergency hospitalization. Why is this happening? And I eventually found out by making phone calls and talking to people about this, that this is surprise billing. I was getting surprise billed for my hospitalization. Now, those of you, and I didn't know what surprise billing was until I heard about it here. So those of you who are unfamiliar with the issue of surprise billing, here's a perfect explanation for exactly what this is.
Good afternoon, sir. How may I assist you today? Hi, you guys were refusing to pay the bills from my emergency hospitalization because my doctor was out of network. Yes, sir, that's correct. But the hospital I was taken to by ambulance was in network. Oh, yes, sir, that's correct. But the doctors that work inside the hospital were out of network? Well, some of them are in network, but not yours. How do you decide which doctors are in network? Well, they sign a contract allowing us to not pay them very much money. But not all doctors sign that contract. Correct, like your doctors, sir. But I didn't choose my doctors. I had a cardiac arrest and woke up in the ICU 3 days later. Well, we do recommend patients call us prior to using any medical services. Well, there's a toll-free number on the back of your insurance card.
So it's and so going back to our friend Sigmund Freud, you know, the joking avoids internal and external obstacles. This is what I was doing, because this is my motivation for using humor, because at that point when I made that video, I had exhausted all other possibilities. I had spent hours on the phone talking to Cigna, trying to get them going through my HR department, going through the state medical, health, state Department of Health, and we couldn't do anything to get them to pay these bills. And so I used humor as a coping mechanism, as a way to deal with this, to try to gain control over this situation. And so this is just a really important use of humor, and it helps. It's a way of dealing with these difficult situations. And so, in the last part, another big motivation for humor, using humor, and this is particularly true in medicine. And by the way, if we're going to have time for questions at the end of this, and so if you guys want to ask, have questions about, my insurance saga, there's a lot to unpack there, which we don't have time for today. But I'm happy to answer questions about that. But up until now, I've talked about humor as a way of dealing with personal tragedy, of dealing with or not even just tragedy, just personal feelings, personal motivations with regard to yourself. But a huge part of using humor in medicine is also summed up by Ted Cohen here, who said that if you laugh at my joke, it means that we are alike in some way, that we see the world similarly. And so the idea is that humor is used as a social function. We're using it to connect with people with similar experiences to us, who may understand us. And we do this all the time in medicine, in particular with social media. But it's nothing new, because for those of you who, I guess I have to include myself in this, those of you who predate social media with your career, know that we've been joking with each other for decades. But before social media, it was in our break rooms, it was in the hallways, it was in the cafeterias, at our homes, on the phone, and we were connecting with each other through the use of humor, dealing with the internal and external struggles that we all had collectively, that we all shared, and we've done this forever. But now social media has changed that. Now we do this, and we're able to connect and form our social support system much more broadly from people all over the world across multiple specialties. And it's a double-edged sword, because that's a great thing. That's a great thing that we can address all those feelings and our fears, our anxieties, our successes. We can address all of those things through humor to a much wider audience. But the other side of that, it's also a much wider audience. It's public. It's people that are not our trusted friends, people that we don't know very well and feel comfortable telling a joke to, but we're still doing it on social media. But anybody's listening in. And so now I have a good amount of experience as a comedian who just so happens to also practice ophthalmology. And so it's, our use of humor has to change. It really does, because it's with social media just changing so many aspects of our lives. We can't always continue telling jokes the way we used to before social media. It just doesn't work, and it should change. And so I have just a few very basic rules, some more like guidelines for how to use humor in social media, because I do think it's an incredibly important thing to do, and you'll see why here. So the first one is knowing your audience. Just like telling jokes in the break room, you got to know who you're talking to. It's important to know your audience, because if you're using humor to develop your social network and to become close to people, and to find people that experience the same things you're experiencing, you have to tailor your humor, your content, whatever you're talking about, to those people to find your network. And so whether or not it's just ophthalmology, which is the way I started out doing comedy, just telling ophthalmology jokes, that did not get me very far, because ophthalmology is, first of all, an incredibly small specialty, also incredibly lame, or honestly. And so I quickly branched out to other specialties, and now that's where I am now. So I tell jokes about pretty much anything in medicine. That's allowed me to grow my audience. And so determine who your audience is going to be, and then make your content, use your humor, your wonderful sense of humor, to appeal to that audience. And then you're gonna create a much more rich social network for yourself. All right, and this is probably the most important point on this slide, is punching up, not down. This is not a new thing. This is a guideline in comedy, that's been around forever, where the subject of your joke needs to be either people on your level or people or institutions that are perceived as being more powerful than you. All right, so if you're a med student, and we do that a lot, right? That's why med students do skits where they roast their attendings. That's why we all make fun of hospital administrators. It's because those are the power structures that we can make fun of, but you can't go the other way, because it's perceived as bullying. So attendings can't make fun of it. It'd be like if attendings did skits where they made fun of med students, like that would be horrifying, right? Wouldn't it? Or if doctors, made fun of nurses, or those things, that it just doesn't work, because it is a lot of times it is bullying. It's perceived as bullying because of those power dynamics. And the problem is with medicine is full of power dynamics. It's just one big power dynamic. We have people at all these perceived levels, for better or worse. That's just how it is, from doctors and administrators, attendings, nurses. It's all over the board. And so when you're using humor on a public platform in social media, Twitter, Instagram, whatever it is, you have to be aware of those power structures, and you have to know who the subject of your joke is. And the reason I'm telling you about all this is because I have made these mistakes. All right. And the one thing you can't do is be perceived as making fun of patients. You can't do that. There's no way that I would ever tweet this now. This is like 3 years ago. And it's even though it's I've seen worse, but it's something you just don't do, and it's not worth it. Even though there are things that we struggle with how patients act toward us. with what is said to us and all these things. But when you're making jokes, it's different than expressing frustrations. All right, you can't be perceived as making a joke at the expense of a patient. You just can't do it. And so and then another thing, obviously, avoid any and all HIPAA violations. So it's keeping obviously patient identifiers away from social media. You guys all know that. But one thing that I still struggle with sometimes is using time designation, saying had a patient vasovagal today, or had it or something that happened yesterday. Don't try not to give time designations. Make it time immemorial where people don't know exactly when something happened. And again, I still make this mistake from time to time. It's not a huge one, but it really is important. But just keep that in mind whenever you're really using humor on social media, but anything, any kind of public post. And then the last thing is also incredibly important. Okay, if you're ever not sure where to go with something, you have these obstacles inside of you, internal, external obstacles you're dealing with. Uh, if you're not sure how to approach them safely on social media, you can always direct the humor toward yourselves. You can always use self-deprecating humor because it's accepted pretty universally in medicine. And part of that is because um, we are so used to, we take ourselves so seriously. And I think to a fault, we take ourselves too seriously. And for, throughout history, doctors have been put on this pedestal as these perfect beings, that we don't make mistakes, that we take ourselves so seriously that we can't laugh at ourselves. We can't look at those absurdities in our job, and make fun of those things, make fun of some of the things that we do. And I think that's a detriment to the field of medicine because we're not perfect. We make mistakes. That's why I talk about and that's why I talk about things like surgical complications, because I think it's important for the general public not to think that we are infallible. And unfortunately, that they think that way a lot of times. And believe it or not, I have gotten pushback on social media for doing things like this. And I'll show you an example. This is something that when you watch it, I promise you, at least all the attendings are gonna this is gonna resonate with you. And I think it's a form of self-deprecating humor. And I had people that got really upset with me for posting this.
Hey, what's going on? Remember that patient you saw last week?
Who can say where the road goes, where the day flows, only time. And who can say if your love grows as your heart shows, only time.
So it's, this is one of those things that when you hear the words, hey, you remember that patient you saw last week, our immediate thought is, oh, what did we do wrong? What happened? Even now, I still think, what did I kill a patient? I'm an ophthalmologist. Why would I ever kill a patient? I still think like the worst that could happen. And it's, but these are, I really think it's a good thing for doctors on social media to talk about our fears, to talk about the things that we're anxious about. This maybe is pushing the envelope a little bit, but I think it's important because we're all feeling these types of things and we can all lift each other up when we talk about these things publicly. And it's important because then it allows the general public to know that we're human, that we're just people like they are. And so think about that whenever you're using humor. Consider letting your guard down a little bit because it's really it's a good thing. It really is, and people will support you. And so I'm going to leave you. This is my last video I'm going to show you, and then I'll have time for some questions. of this. This is kind of like the more typical self-deprecating humor that I like to use. A question I get a lot is how I have time to do all this.
Hey, yeah, you're a doctor. How do you have time to make all these TikToks? I'm an ophthalmologist. Son of a bitch.
Well, one of my favorites. So that's all I have for you guys. I'm happy to answer any questions if you want to talk about social media, my health history, whatever you got. I'm an open book. So I appreciate the time to talk to you guys. That was a lot of fun. So I appreciate it.
Great. Thanks so much. It was fantastic. And I think eye-opening and insightful, and also very funny and enjoyable to listen to and watch. I guess, I'll start out, and then people can unmute themselves and ask questions, or if you want to post anything in the chat box, I can read it, or Will can
I'll
take it
monitor the
directly.
chat here too. So if anything comes up, I can address it.
There you go. So I guess, you talk about, being human, and, all of us, we all have senses of humor. Some are more refined and or less refined than others. And some of us are more comfortable integrating our humor into our daily lives or into work than others. And I think when I think about why people may use or integrate their sense of humor less into their work, it maybe they're afraid of trying to be funny and failing, not being funny, or afraid of being funny during a serious time and it being, ill-timed and ill-received. So I guess one question is, how do we know when we're at work, when it's okay to try to be funny? There's certain times, obviously, during a cardiac arrest when that's not okay. And there's other times where it's clearly okay, but most of it's all gray area. So how do we know when it's okay?
Difficult, right? Because I think actually one of the things that that we do when we're extremely anxious is sometimes we laugh because we have such an intense amount of anxiety about something, or something that catches us so off guard that it's like a reflex to just like to laugh. And it's one of those things, it allows us to deal with this situation where and these feelings that we don't know how to deal with. And it's a hard question to answer because a lot of it is just you have to learn how to do it. It's not something that I think you just know innately, okay, this is a good time to tell a joke, this is not a good time to tell a joke. And I've made plenty of mistakes myself. I think you have to censor yourself a little bit, especially as a physician. If you're in other fields, maybe you don't. Maybe it's more acceptable to use your sense of humor, but you certainly have to censor yourself a little bit. And I think the key is just a little bit at a time until you get comfortable. You kind of know what scenarios it's okay to tell a joke with, and it's okay to joke about this particular topic. And so it's a lot of it's trial and error. You just kind of like try a little bit, see how it goes. Try a little bit, see how it goes. And it's you see people make mistakes all the time on Twitter, telling an inappropriate joke, telling a joke about something, bad timing. It's not a good idea. And a lot of that is again, you learn for next time. That's unfortunately, that's a big part of it, is just experience. It's hard though. I mean, like I said, I would consider myself like a semi-professional comedian. I've certainly made money doing comedy, and and I still make mistakes. Comedians still make mistakes all the time about doing stuff like that. And it's just harder because as physicians, we're held to a higher standard, with what we're saying, and our words mean more to people. And so you just have to keep that in mind whenever you're using humor. And another thing I should mention is it's also about what you're normal persona is, especially when we're talking about social media. If you're a person that doesn't tell jokes, well, the minute you tell a joke, it's going to throw people off. So you also have to think about what what people's impression of you is already on social media. Like if I just started tweeting political views, like without any kind of humor or anything, it'd be like people, what is this? Why is this happening? And so if you're the type of person, and some people, it's not something you like to do. You just don't tell jokes in that kind of public forum, and that's okay. But you have to realize that people have a perception of you on social media, and if you change that perception too quickly, too drastically, it's going to throw people off. They're not going to know how to react to that.
David, good morning. Thank you so much for your presentation. In my role as Senior Associate Dean for Education, I really appreciate listening to this and the comments about censure, because I think that we have to be really mindful when we have learners around. And, you know, I'm someone who likes to joke around, and I kind of have a smile and a twinkle in my eye, and I think it's perceived in the right way, but it's not. And so I think we just have to be very, very mindful when we have our learners and we make any comments.
I completely agree. Absolutely. And that also goes to those power dynamics, right? Because we have to know who we're talking to, and where they're at from a psychological standpoint, because they're, as med students are just a little, any comment from an attending is going to hold so much more weight. And so you just have to think about that before using humor in a setting where there's a large power dynamic.
Hi, I'm Renita. If I could ask a question, thank you. So I'm also involved with learners at the GME level. And what I like to tell our residents is don't post anything there that you wouldn't say to somebody if you ran into them. And so while humor is, an outlet and it's slightly different, I'm just shocked at the things sometimes that are posted. I mean, I find humor out of that actually, but
Yeah.
It can be very painful, it can be hurtful, and it has unintended consequences. So I think
It's a good point. And you have to strike the right balance. Like, so I started out on Twitter as an anonymous account. And that's mainly because I didn't feel comfortable saying some of the things I wanted to say as a trainee who is subject to discipline from my program. And I think that feeling it's a little bit unfortunate because although I wasn't saying anything outrageous or inappropriate, or I guess depending on your definition of inappropriate, using profanity may be considered inappropriate from some people. I think there's a balance to strike, because the reason I think a lot of trainees, a lot of learners go the anonymous route on social media is because they have a lot of these feelings of anxiety and fear, and the struggles that they have in their day-to-day life, and they don't feel comfortable having their employers know that they're struggling with certain things. And I think that's a bad thing. That's something that's I wish that we could do better at in allowing learners to feel comfortable expressing their fears and their anxieties. On the flip side, though, you can go too much the other way with it and be inappropriate and unprofessional to the point where it becomes a problem. And so I love when people are themselves on social media and feel empowered to address those all the fears and anxieties and successes they have. Again, going back to the point about doctors being infallible, and because we're and showing a little bit of vulnerability as physicians, I think is very important for us to be able to express on social media. but you're right. You got to do it in a way that's not inflammatory. That's still maintains professionalism, and that's a hard balance to strike. It really is. And a lot of times people make mistakes, and they learn from those mistakes. And I wish there was like a document that told people how to do this, like this is the way you do it, but it's so personality dependent and person dependent. And so there's not a right answer. We just have to try to guide people, I guess, with talking about things like this.
So this is Laura Willett. I'm also involved with learners. And I really appreciated your comment about hitting up rather than down. And I tend to make a fair number of, I think, sort of dark, humorous comments about our health insurance system or lack of system to our learners. And I wonder sometimes if it's appropriate. I've said things like, because in New Jersey, if you have HIV, all of your medications are covered. Whereas if you're poor and you have diabetes, your medications aren't covered. And I was like, well, he should just go out and get HIV. Then all of his diabetes medications would be covered. And nobody's ever reported me for that, but I've worried that maybe that's an inappropriate thing to say to a learner. But it kind of points out how crazy our health system is.
Yeah. I think, and part of what you're talking about is gallows humor, which is actually it's a pretty big part of what we do in, it's a large part of humor, and it has been for a long time. And I think it's the, for stuff like that, it's the environment you're telling it in. It's knowing your audience, knowing the people that you're talking to. If you said that on social media, bad idea. Like that's not something you say to a wide audience. You got to know the situation. I think it's an okay thing to say, because you're not, the point of the joke is you're pointing it toward these institutions that are more powerful than all of us, right? And so from that perspective, it's fine. But it's also, again, using your own discretion and knowing, okay, who am I talking to? Is this, do I feel comfortable saying this? And that's a huge part of it. And so, yeah, I think knowing the butt of the joke is important. And I think it's fine. We have so many problems in our healthcare system, and a lot of times we don't know how to deal with these things. And though we have those internal and external obstacles that we're butting our head up against, and we don't know how to deal with those. And so a lot of times we'll use humor to try to rise above it, try to gain control of that. I see some comments here. The house of God. Yeah. Yeah, the house of God is, I read that, I read it a long time ago. Obviously it was written in a different era. There's a lot of there's a lot of problems with the book. I think overall, I still think it's a good book for, I would encourage any trainee to read it, because it's funny. First of all, it's a funny book, but I think anybody who read it now would understand the problems with it. There's some rampant misogyny and racism in the book, and I think it's actually informative to read stuff like that. That's I think we can all, and then talking about it. I think I actually I need to go back and read that book, read it again, because it's been a while since I've thought about that book. I do remember reading it though and thinking, oh man, you can never say that now. Like that's something, there's some sketchy material in that book. Funny though. Oh, somebody had said, can you comment on your social media presence and potential considerations with colleagues or employer? So I talked a little bit about that, but it's there's a reason that I started putting my face out there once I became partner in my practice. So it's it's really, and thinking back, I probably could have just had my face and my name out there as a resident, because I don't think what I was saying was particularly harmful to me. but it can be harmful depending on it. Just there's so much you don't know. Whenever you have a boss, when you're an employee, there's so much you don't know about your boss's, personal feelings about things, right? And so you really you got to be careful, and you got to be more careful than if you're your own boss, or if you're a comedian and you don't have it to answer to anybody else. You can say whatever you want, but especially in medicine with those power dynamics we're talking about, it's just unfortunate. A lot of times you can't be yourself, and that's, I don't know how to change that. And it's dependent on the situation, the employment situation you find yourself in. But I think all trainees should be very careful still. And so, but again, it's the balance, because you really want to empower trainees to be able to, especially with mental health issues with learners, you want them to feel like they can be themselves and express some of the internal struggles that all trainees have. And especially now in the pandemic, when we can't do that in person anymore. So how do you do that? And you see it a lot now. A lot more people are joining up on Twitter in the medical field, and talking about some of these things, some of the difficulties they're having during the pandemic, which I think is great. It's whenever you use humor in that space, that you have to be just a little bit more careful whenever you're addressing those types of things.
It's with the time, I think keep going for a couple more. Just for those of you who need to jump off. Thank you, Dr. Flanary. Again, there's no reason why we couldn't go for a couple more minutes and let you keep answering, because I know there's lots of questions coming through.
So I can, I have to get on to surgery here in a little bit, but there's one thing, let me say, first of all, thank you again for everybody. If you have to jump, please feel free to leave if you have something you got to do. It's the work day for you guys. So thank you so much for listening and for joining. What a great audience. This is great. A time when when my sense of humor got me into trouble. So honestly, I can say it's never gotten me into trouble with my job, and it has not gotten me into trouble with a patient. And I really owe that, I think, to just, I have so much experience now telling jokes, and I think my stand-up background has really helped me in that regard, because I have a better idea. I'm pretty good about reading my audience and knowing kind of what's going to work, what's not going to work, what's going to be appropriate, what's going to be inappropriate. So the times that I've gotten in trouble is when I'm posting on social media to people I don't know. And so, getting negative feedback on jokes I tell on Twitter, and the whole reason is just because I don't know these people, right? I'm not looking at them face to face, reading their body language, knowing who they are, to know what joke people are going to find inappropriate. And there's no way to do that well. Like, there's no way to know how a stranger halfway across the world is going to take your joke. And so you just kind of roll with it, and you trust that what you're saying is okay professionally, and that you can back up what you're saying if you need to. And so that's why it just takes discretion, and it takes a little bit of trial and error to know what's okay and what's not okay, and learning from others too. Because when you're on social media, you see other people saying things, and you see the kind of backlash they get sometimes, and okay, it's not okay to talk about patients being non-compliant in public, because you're gonna get some people that are not happy about that. All right, it's so there are certain topics really that you uncover that way, and then you can just stay away from them. Well, thank you so much. I guess I should get going. I appreciate it.
Thank you so much.
Thanks, David.
It was fantastic.